There are three of the public goods provided by the government of Malaysia that lead to market failure. First public good is infrastructure. Public-private partnership, PPP, governmental restrictions and objections from the public sector are frequently placed on private parties. This may be the case because the politicians are unable to recognize the benefits of the PPP process since they are unaware of the project's long-term costs. Besides that, the federal government is ignorant of how PPPs are implemented. One example of a failed railway project in Malaysia is the Kinabalu Railway Project. The project, which was proposed in the early 2000s, aimed to construct a railway line connecting Kota Kinabalu, the capital of Sabah State, to Tenom, a town located in the interior of the state. The railway was intended to serve as a tourist attraction, as well as to provide a means of transportation for locals. The project faced numerous challenges from the outset: disputes over land acquisition and environmental concerns. The cost of the project was deemed to be prohibitively high. Government was unable to secure sufficient funding to move forward with the project. The project was shelved in 2011, and there have been no further attempts to revive it. The second public good is education. One of the biggest failures of the government education system in Malaysia is the low performance of Malaysian students in international assessments such as the Program for International Student Assessment, PISA. Malaysia has consistently ranked below the average of participating countries in PISA, with particularly poor results in areas such as mathematics and science. There are several reasons for this poor performance, including inadequate resources for schools, a lack of qualified teachers, and a curriculum that is not well suited to the needs of students. In addition, there are also issues related to the funding of schools, with many schools in rural areas and low-income communities receiving less funding than schools in more affluent areas. Another challenge faced by the education system in Malaysia is the lack of access to education for some groups, particularly those from low-income and marginalized communities. Despite efforts to improve access to education, there are still many children in Malaysia who are not attending school or who are dropping out of school at an early age. The last public good is healthcare. Uneven distribution of healthcare resources. The distribution of healthcare resources, including medical personnel and facilities, is unevenly distributed throughout the country. Rural areas and low-income communities often have limited access to healthcare services and facilities, leading to disparities in health outcomes. Insufficient funding. The healthcare system in Malaysia is underfunded, with a relatively low percentage of the country's GDP allocated to healthcare compared to other developed countries. This has resulted in a shortage of medical equipment, facilities, and staff, as well as limited access to essential medicines. High out-of-pocket expenses. Despite the government's efforts to provide affordable healthcare services, the high out-of-pocket expenses for medical treatments and procedures remain a challenge for many Malaysians. This results in limited access to healthcare for low-income individuals and families. Overcrowded public hospitals. Public hospitals in Malaysia are often overcrowded, leading to long waiting times for medical treatment and procedures. This results in delayed treatment, worsened health outcomes, and increased financial burden on patients and their families. Limited availability of specialized medical services. Specialized medical services are often not available in many parts of the country, leading to delays in treatment and increased costs for patients who have to travel to access these services.